Hi everyone, welcome to the Imaging Study YouTube channel. Today we are going to see a case of fibroid uterus. Around 30 years old female patient came with a history of pervaginal abnormal bleeding. On ultrasound, we can see a bulky uterus. A large heterogeneous area almost completely occupies the body of the uterus. Patient's urinary bladder was empty and catheter is noted in situ. Here you can see the heterogeneous area at the level of the body of the uterus. Cystic area is the catheter balloon within the empty urinary bladder. On real time, you can see the large heterogeneous fibroid occupying almost whole part of the body of the uterus. This heterogeneous appearance represents degeneration within the large fibroid. Color Doppler shows internal vascularity within the mass. That's all for today. Thank you for watching.